Hey guys, it's Dr. Justin Marchegiani here. Hope you're having a phenomenal morning. Let's dive in. What's going on your mind? What's up in the health world today? So we're coming fresh off the Thyroid Summit here, which is great. So any questions on the thyroid area, feel free and let me know. I will be having a thyroid masterclass starting, and it'll be a more kind of broader, in-depth class on dealing with thyroid issues. If you have any thyroid issues, look for that. Make sure you subscribe to the newsletter at justinhealth.com so you get updates on that. So what's going on? Questions here off the bat. CWV writes in Dr. J, I have a chest injury for the last year and a half that will not heal. I've tried everything. Do you think parasites, nutrient malabsorption could be responsible for my body not healing? So it depends, right? What kind of chest injury? What was the mechanism? Was this like a car accident or a fall or more of a chronic kind of thing? So you may want to make sure the root underlying issue is fully addressed. If it's an acute trauma, then you probably need to see a really good chiropractor / active release therapist or myofascial release massage therapist to really make sure the adhesions and scar tissue is broken up. The chiropractor will make sure the joints are really moving well, and of course, incorporating some exercise so you can build some muscle to make sure that area is stronger and more stable in the future. Cheryl writes in, would you have a protocol for getting someone off Coumadin? Reasons, PE due to either birth control or positive lupus, anticoagulant, and do not want to risk clotting, but do want to be on Coumadin. So in regards to Coumadin, that's a blood thinner, right? It's actually was a rat poison used in the 70s, right? They gave it to rats. Rats would run, bump themselves, and then hemorrhage and bleed out. So essentially with Coumadin, big things, we got to get inflammation down. That's number one. Inflammation causes cells to stick and to coagulate, number one. Number two, we can give things that are, so of course, like a paleo template will be that. Getting the, of course, insulin and carbohydrates in check, because too much insulin and carbs will cause cells to stick and coagulate too. Number three is we can use specific supplements to help thin our blood. So of course, fish oil and omega-3 fats is number one. Ginger is an amazing anticoagulant. That's number two. And then after that, you can use various systemic-based enzymes taken away from food, because those will kind of go into the bloodstream. They'll hit and attack fibrin, which is part of like the clotting protein. It'll break that down. Then we can also add in things like ginkgo and bacopa. These are really good kind of natural oxygen kind of stimulating, blood flow stimulating kind of compounds. Akbar writes in, when one starts lacto-bifido after 3 months of the fourth R and still intolerant to lacto-bifido, after a week, would you recommend? Can one start with a probiotic directly? Yeah, if you're having issues, number one, we should be chatting. It's been a while, so we should update kind of where you're at, Akbar. That's number one. Number two, I typically would put people on a combination of Saccharomyces. And if we're really having a lot of problems with that, I would taper it up. And number two, if we're still having issues, we would look at like a mega probiotic for sure. Cheryl writes in, what's the most definitive test for H. pylori? Stool was positive, but breath test was negative. That's it. As long as you have the stool test positive, stool test is still the gold standard. So if you have positive on that, you're good to go. Got to get after it. What do you think about Frank sign, the earlobe crease? Is that just like a little crease right here in the earlobe? From what I remember with my readings on that, that's a cardiovascular issue. I mean, it's one thing I never would hinge any of my clinical prognosis or diagnoses on one sign, but it's just something you just stack onto that list for sure. Rhonda writes in, what are your thoughts on Shu Wu for inflammation? I read it could help cause liver damage and mimics estrogen. Is that like an herbal support for hormones? I think that's more used in the Ayurvedic Oriental medicine. I need a little more information on that to give you a good opinion. Ashley writes in, what are your thoughts on food combining? Is it okay to eat starch with protein? Should fruit be eaten on its own? It just depends, right? If you have really poor digestion, Ashley, and eating starch really causes a problem with your protein, all right, I mean, I would say get your HCl, get your enzymes dialed in first, and I would look at cutting out the fermentable carbohydrates first. That may be your best first step. And if that fixes the problem, great. And then regarding fruit, I mean, I would just make sure the fructose is lower in the fruit and lower FODMAP as well. If that does the trick, great. I find most people don't necessarily need to do that, meaning they still have good digestion, no bloating, no gas. I just can't imagine like our prehistoric ancestors going out and being like, oh, I just ate some meat. Like I got some berries here, but let's wait a little bit. I just couldn't imagine that. So in general, but if you have really poor digestion and you have a lot of fructose malabsorption, that may be a good idea, right? The whole idea of eating fruit by itself is that fruit essentially gets digested much faster and passed along the digestive tract, where it may get held up with a lot of the proteins and fats in the stomach. So then it may have more time to kind of ferment. That's the general gist. That I think the body ecology diet talks a lot about that. So in general, I would say for some people it may be necessary. I think most you can probably figure out underlying physiological boosters that may help, like digestive support and the fermentable carbs. Ty writes in, Dr. J, my husband has a complete white nail, bends on all fingers, GGT 70, ALT 37, fasting insulin 3.7, glucose 105, liver disease or diabetes. What can help it? Well, I mean, the GGT, that's more gallbladder. That's pretty high. ALT is definitely right on the fence. Fasting insulin isn't bad at 3.7, but glucose is a little bit high. I need a lot more information though. I mean, first off, there could be just a lot of malabsorption and he's not breaking down a lot of protein and good fats to build up that nail tissue. It could be something as simple as that. I don't even know your husband's height, weight, or build. I don't even know lipids. So like typically we'll see like elevations in triglycerides. We'll see elevations in potentially even cholesterol and lipids overall with that, because you'll see that because you're getting excess fat deposition in the liver. So it's hard to say. I need to see diet as well. So not enough information there. Samuel writes in, hey, Sam, hope you're doing well. I'm going to Peru this summer for a hike in Machu. What do you recommend I take with me so I don't get any parasites, and helping with adrenals to make the hike successful? That's a great question. So in general, I would say definitely some clearing herbs. So like in my line, I would do like at least an oil of oregano, like a GI Clear 5 or 4, kind of a good oil of oregano, good anti-parasitic herb in case you get any food poisoning at all. Number one, I would do probiotics just in case you have food poisoning as well, because probiotics are great for food poisoning. And then I'd also do some activated charcoal in case you're eating any questionable food, and just to help bind up anything that may be just, out of the ordinary. Cheryl writes in, will you be at PaleoFX this year? I don't think I will be this year. I was not invited to speak, so I will not be there this year. Maybe next year. We'll see. What are the health benefits of poppy seed oil? I'm not sure. I mean, poppy seed, not sure. I mean, I know poppies, that's not the same kind of seed as a CBD. I'm not sure. Pink writes in, how does one properly detoxify and decongest a fatty liver? Great question. So the first thing is, if you have a fatty liver, it's typically too much carbohydrates and fructose. So we have these JNKY enzymes in the liver, and fructose really screws these enzymes up. So you get a lot of non-alcoholic steatotic hepatitis, and you basically convert a lot of the excess fructose to fat in the liver. So fructose primarily gets stored in the liver, about 80%. Glucose primarily gets stored in the muscle. So of course you get about 4 to 5 times more reservoir in the muscle. And of course, if you move, then you wring that out and you burn that carbohydrate / glycogen up before it gets converted into essentially fat. So that's the general gist. And when you have fatty liver, it's typically from excess carbohydrates and fructose. You only got about a 60 to 70 gram reservoir of fructose in the liver. So you don't have much. So once that's tapped out, you're going to start depositing that fructose as fat in the liver instead. Great question though. How can you explain the difference between K1 and K2? Which one does Coumadin inhibit? K1, just think of K1 as more going to be plant-based vitamin K. Think of vitamin K2 as more animal-based vitamin K. Weston A. Price called vitamin K2 activator X. You're going to see a lot of it in good quality butter oil or ghee or good healthy animal products. I think even cod liver oil too may have vitamin K2 if it's fermented. And then how does it inhibit Coumadin? So vitamin K, which is rich in a lot of green vegetables, it helps with clotting, right? So one of the big problems is you see a lot of elderly that are on blood thinners. They're just constantly like bruised, like all over, because they just can't clot. So their blood's just like all hanging out here, right? Because it's so thin, it can't clot. So it just constantly spreads like a spider web. And then a lot of times though, like with Plavix, they don't have to do these INR testing anymore. So Plavix is kind of one of the newer ones they use. But typically with Coumadin, they'll run INR testing, which is like looking at clotting factors. And like a lot of times it's really sad. They'll discourage people eating more green vegetables because they don't want to change their dosing. So I've seen patients where they're like, yeah, you only can eat your 2 servings of greens a day. And it's like, well, we got to eat more. But the doctor's too lazy to adjust the INR. or to test the INR and readjust the medications. So my whole thing is if you can get inflammation under control and you do some of the supplements I mentioned earlier to help promote blood thinning, you can typically, with your doctor's support and guidance, you can get off of it. Got to be careful. If you're a previous stroke person or heart attack person, you don't want to do it willy-nilly. All right, great questions so far here, guys. Love it. Keto diet good for candida overgrowth? Yeah, I think it's great. I mean, you're going to starve out a lot of the candida through just cutting out a lot of the carbs. Now, you get guys like Chris Kresser that will say, well, there's some research with candida being able to consume in fuel on ketones. I just think personally, you're going to have glucose and carbohydrate and fructose are going to be the major source of feeding candida. I mean, it's possible, but especially if you have candida from excess carbohydrates and grains, that's the first thing I would do. I think in general, there may be exceptions. Kind of going on a paleo keto will definitely help candida. Havani writes in, I have hypothyroidism and I'm a 48-year-old pre-menopause. Is there any way to cure that to help balance estrogen and progesterone? Yeah, you need to get first looked at. You need to get first assessed by your good functional medicine doc to look at and see what kind of pattern you have with your hypothyroid. Is there autoimmunity? Is it just a straight up TSH elevation? Is there a T4, T3 conversion issue? Is there an elevation of reverse T3? Are there any adrenal issues? Is there any hormone metabolism issues where you're having a hard time metabolizing estrogen? What's your diet like? So there's too many factors that we'd have to dive in, but you'd want to really have someone look at all those individual factors because your adrenals are going to play a huge role as you go into menopause over the next few years. You're going to produce a lot of DHEA from your adrenals to help make a lot of that precursor for your like estriol, for instance. So you really want to get looked at and assessed better. Gabe writes in, Dr. J, I did a 20-hour fast yesterday on hour 18. I noticed some very mild acid in my throat. Any idea what might be there since there shouldn't be any food acidifying? Hard to say. I'm not sure what's going on there. So you only drank water the whole day and then you had a little bit of acid burning? Hard to say. Did you drink any like lemon juice or any teas at all during the day that could have been a problem? If not, I would definitely look deeper. It could be some H. pylori or something else hanging out in the gut that could be an infection stressor. Sam writes in, my father's 56 years old. He's been really fatigued for the last couple of weeks. He could barely stand. He has headaches as well. His blood work turns out good. So what could it be? Yeah, I would have to run a full workup to figure out what's going on. Gut, hormones, adrenals, thyroid, mitochondria. Just not enough information there, Sam. But you need a good functional medicine doctor to work it up. But all those areas need to be looked at fully. Okay, cool. Ashley writes in, thoughts on coffee enemas. I mean, great if you really want to accelerate detoxification. My mentor, Dr. Robert Rakowski, always says the best part of waking up is Folgers in your butt. So coffee enemas are great. They increase glutathione. They kind of help wring out that liver and gallbladder of any junk that could be hanging out there, especially the gallbladder, because it's kind of, a lot of that stuff could be in the bile getting ready to be released into the intestines. So it can, one, release a lot of that. It increases glutathione and it gets it out fast. So it's really good if you're really toxic, especially for cancer patients. It's awesome. Like it's part of the Gerson protocol, which is a big cancer protocol. But in general, for most people, it may be just too much, right? Pain in the butt, pun intended. So typically just using like a lot of the detoxification nutrients and herbs and vitamins and amino acids and glutathione and herbs to help tonify the liver, and maybe just a good infrared sauna may be enough for most people, and they don't have to go to that extreme, but I think it's still good. Hishiwu is also known as Polygnum multiforum or Foti. It's Chinese herb. Wondering if it's good for inflammation. Yeah, I've heard good things about it. Just I don't use it in my practice, so I'm not a pro at it, but I have heard good things about that. Dennis writes in, if vegetables are important sources of essential dietary nutrients, how do carnivores live healthy without them? Well, I think number one, you're getting a lot of vegetation nutrients in the meat because you're eating animals that are going to be grass-fed, right? So you're getting grass-fed animal products, which are going to be different than a grain-fed or a corn-fed cow, for instance, number one. Number two, you'll be adding in organ meats, which would blow any plant-based product out of the water. I mean, if you just Google nutrient comparison of kale or a carrot versus liver, it's not even close. So I do think if you are going to be carnivore or you're going to try carnivore, getting some organ meats in there would be essential to get those extra nutrients that you may not get. Great question, though. Jody writes in, what are your thoughts on receding gums? Why do gums start to recede? And is there anything that can be done to help stop the process? Yeah, so in general, you got to look at inflammation. So the first thing is look at inflammation in your diet, right? Number one. So of course the diet has to be addressed. Number two is your microbiome. Do we have a lot of bacterial overgrowth? A lot of that could make its way up because essentially the esophagus is part of the intestinal tract, right? And that makes its way right up to your mouth. So looking at bacteria, number one, number two, and then number three, having a really good toothpaste that will help. So a lot of good toothpaste will have beneficial pre and probiotics for the oral microbiome, number one. And then number two, they'll use some antimicrobials that will help kind of like, let's say, knock down some of the bad stuff. So I'm a big fan of Revitin, which has tangerine oil, lemon oil, citrus oil, a lot of good essential oils in there that really help kill any of those microbes. It has prebiotics and probiotics to help a lot of the beneficial flora, and it has a lot of various minerals and CoQ10. CoQ10 is essential for helping with receding gums. Great question. All right, a couple other questions here. Pink writes in, is coffee enema okay if you have a genetic problem metabolizing caffeine? Maybe not. Try it, see how you feel. If you feel really jazzed up and over anxious and overstimulated, probably not. Doc, I have sinusitis, no taste at all. How can I cure it? Well, figure out what the underlying cause is. Is it an environmental thing? Is it a food thing? Number one. Number two, I'm a big fan of either the Nasoline or the Xlear rinse, like the actual bottle where you spray it and inject it up the nose, not a neti pot. It's not enough force in the neti pot. And then we use the Xlear neti solution, which has the xylitol and some of the bicarb minerals, which will help. One, it won't sting the nasal cavity, but it will also kill a lot of that dysbiotic, not so nice bacteria, maybe even fungus up in the nose. And that will help flush it out, typically 2 to 3 times a day on each nostril. Okay, Rhonda writes and did omega-3 test and it was low. How much to supplement? What do I need to get the levels up? Using Carlson's Super Omega-3. So first off, I mean, you can do an omega-3 test. That's fine. I just look at someone's diet, right? All right, how much omega-6 plant vegetable oils are you doing? How much nuts and seeds are you doing? And then the rest would be, okay, now are you eating grass-fed meat? Are you consuming good quality fish? Are you doing a fish oil supplementation? Right? As long as you have those things in there and you're minimizing all the extra omega-6s, you're going to be in pretty good shape. I mean, the goal is, 1-to-1, 4-to-1, so to speak, omega-6 to omega-3. Of course, you could start off at, anywhere between 1 to 2 grams twice a day. Some may even go higher up to 8 grams. If you're going higher up to 8 grams, you really want to make sure the fish oil is the best quality possible so it's not oxidized. And I'd also make sure you're doing extra vitamin C to prevent any lipid peroxidation. Okay, great. Matt Arcodani writes in, 40 days on GI Clear 3, finished in 6 months, never been able to increase tolerance or go up to full dose despite tapering and titrating up several times. Follow supplement reaction handout and added in binders to no avail. Also did not see any improvements of symptoms after 6 months. Okay. So in general, I mean, it just depends what I have no idea what you're even treating. Number two, I would never, ever just use GI Clear 3 or silver by itself. So I'm not even sure what you're treating. Number one. Number two, I would never, ever just use GI Clear 3 by itself. So something else is going on. And if it took you that long, you probably needed to go slower or a lower dose. And you shouldn't have gone 6 months, and you should have had detoxification support in the background as well. And again, this is what happens when patients or when people aren't seeing a clinician, which I'm guessing that may be the case because you're taking some of my products incorrectly. I'm guessing that may be the case. So this is why you got to have a good clinician to guide you. So a little bit backwards there. Sam writes in, hey doc, have you heard of having proper tongue posture to help with breathing better for homeostasis and TMJ? I believe the term is mewing. So, I mean, typically your proper tongue posture should be like right at the roof of your mouth. So when you swallow, that should kind of be the spot where it should be. Or if you're doing more movement, it should definitely be there because that kind of anchors these hyoid muscles. When your tongue is just like flaccid in your mouth, these muscles are kind of a little bit looser. But when you put your tongue on the roof of your mouth and you feel these muscles, they're more taut. You can just take your tongue and go in and out, and you can feel these muscles moving. So you really want to have your tongue anchored right at the roof of your mouth. So when you swallow, that's where you want your tongue to be. All right, let me go hit a couple of Facebook questions here, guys. Let's see what's going on in Facebook world. All right. Best friend's having trouble with depression. Could this be a thyroid related issue? Yes, it could be 100%. Yep. Check out the Thyroid Summit. We did a couple of talks on that. Ryan writes in, hey, Ryan, any days on helping a young woman who just started menses and is now being homeschooled because of intense pains, full body migraines, vision changes, anxiety, depression? Thanks. Yeah. So first thing, if woman just started menstruating, we want to stay away from any hormones. So what I would personally do is just make sure her diet's really clean, number one. Number two, I would be utilizing things like chaste and maca just to help gently nudge and balance the hormones. I would make sure we add in extra magnesium in that last half of the cycle just to help with muscle relaxation, to help with cramps. And we can also add in a herbal compound called cramp bark. But I would really work on the diet, inflammation. I'd really work on blood sugar stability. So the blood sugar is stable. It's not going up and down. I'd really work on magnesium. Fish oil would be helpful. I'd really work on those things at a foundational level first. Okay. And then let me know how that goes. Hope that helps. Heidi writes in, what is your main format? What are you answering all these questions from? Yep. So we're on Facebook. I'm sorry, YouTube. Facebook, I don't like as much for questions. YouTube is my main get up. To get on there, go to justinhealth.com/YouTube. Dr. J, you suggested a couple of weeks ago, I searched for your website for a podcast discussion on oxalates and didn't find anything. Can you post a link? Everything's transcribed. So if I talked about it, it would be on the search. I would just, maybe it's under a different spelling. But yeah, you would have to look. I talked about it many times. All my podcasts are transcribed. So when you go look at the search feature, you should be able to pull up any podcast where I mention that word. Is it safe to add 5-ACP or tyrosine amino acids to flutoxamine to augment? So fluoxetine is essentially Prozac, if I remember correctly. So you got to be careful. You got to really make sure you're working with a functional medicine doctor, and you got to make sure that your whoever the prescribing psychiatrist or doctor is knows what you're doing on that. But yeah, you could, but you got to make sure everyone's in the loop. What are your thoughts on biocidin and parasitics to clear blasto? I know biocidin. I've used that for a bit. It's a good product. Parasitics, not sure what that product is. I'll have to look it up. All right, cool. And what are your thoughts on amalgam fillings? I had all mine removed. It depends. I don't like amalgam fillings, especially the mercury ones. That's typically what they are. We should call them by what they are. They're 51% mercury, so we'll call them mercury amalgams. But number two is you don't ever want to get them removed unless you're seeing an appropriately trained dentist to do it via biological approved techniques, right? Oxygen mask, right? Dental dam, cold water pick, right? Chelation support before and after. And you really want to make sure you see like either a Hal Huggins trained dentist or a International Association of Oral and Medical Toxicology, IAOMT.org trained doctor. Great questions, guys. All right, I got a question here. Elvis writes in, a friend gave me a blood test. What does glucose of 110? That's really high. Creatine at 0.49, that's low. 50 unit of SGOT, which I think that's one of the old liver enzymes. ALT 70, calcium 146, A1C 6.7. Yeah, so this is someone that has a lot of inflammation, more than likely starting to have a fatty, non-alcoholic fatty liver, and is right on that pre-diabetic front. So there's pre-diabetes, there's fatty liver, there's basically metabolic syndrome happening there, and there's a lot of malabsorption too. So you really need to see a good functional medicine doc to get these things dialed in. Can you tell me if histamine causes low stomach acid? In general, I would say you have a greater chance of having histamine issues with low stomach acid. I think it's more causality is reversed, because if we don't break down our foods, there's a greater chance that we're going to have histamine because the food is fermenting, it's rancidifying, it's not being processed, it's kind of rotting. So there's more chance that that's going to cause problems and thus create histamine through an immune reaction, right? Histamine is produced by your basophils. Matt writes in, what can I eat at one meal like squash and fruit for carb backloading? My body temp seems to raise a few degrees, which feels nice. It's especially warming with my extremities and fingers. Great. Yeah, squash, you could do some fruit, you could do plantains, you could do sweet potato. I'd even say you could do a little bit of white potato. So just feel that out and see what works best for you, Matt. Akbar writes in 3 months of antimicrobials, started with probiotic floor. It's been 10 days and I still react. Hey, Akbar, you keep on asking the same question every time. Get in with me, man, so we can chat. You're doing things a lot really backwards. So I want to help you out here, but we need to dive in a little bit deeper. Okay. If you're having issues with probiotics, you got to adjust the dose. We may have to switch some of the strains. Low Heat writes in, can high EBV in the brain cause dizziness? Potentially, but I mean, there's so many other things that are more likely to cause issues with dizziness in the brain, like just gut issues, gut inflammation, dysbiosis, food allergens, right? So there's so many other issues. Like, could it cause it? Yeah, but what's the more likely cause? So when I work up a patient, I'm always looking at like what's the primary causes and work our way down. So of course, like gluten, right? Any inflammatory junky food, right? Blood sugar fluctuations, any kind of inflammation in the gut, any kind of infections, any kind of gut permeability. And then of course we can stack on extra anti-inflammatory nutrients to calm down the brain too. What's the cause of being insulin sensitive? What causes it? Oh yeah, you're talking about just feeling better. Yeah, I just think the fact that you're insulin sensitive and you're getting a little bit more carbon. I think it's just for you, that's just what your body needs carbohydrate wise. And I think you're more insulin sensitive at night. Some say the morning, but there's a lot of carb backloading studies that show people actually losing weight when they only eat their carbs at night. So I have a hard time wrapping my head around how someone would be more insulin resistant at night if we see more weight loss in some of these carb backloading studies. It doesn't make sense physiologically. But I do understand, hey, if I eat more carbs in the morning, I have more time to burn it, right? I get that. But the studies don't seem to show that though. All right. Can you talk more about Megaspore? I just purchased it from your store and being expensive, I want to max the results. Mainly just want to experiment with it for increased gut health. Yeah, I've done a whole podcast on Sporebiotics, Matt. So take a look at that podcast. But in general, it's going to have more of a permanent footing in your gut. And it's really going to help potentiate a lot of the growth of other beneficial flora. It's acid resistant, so you can take it with food. You can start with just one a day, right? One a day is totally fine. You can work up to two. It is expensive, so you don't need that much. So start with one a day, and you can just start with one a day and see how it goes. But it will help potentiate the growth. I think Kiran Krishnan created that product, and he's done some other podcasts talking about it. So he's another good reference too. Have you heard about the Everlywell Food Sensitivity Lab? Yeah, I mean, I've heard of them. That's like a finger prick food lab. It is going to primarily look at IgA or IgG, maybe just IgG. So it's not going to be as comprehensive as, like, for instance, the ELISA ACT food allergy test, which will look at T cells and helper cells and other cells outside of just IgG, IgA. If wanting to do carb cycling, can resistant starch count towards carbs? Yes. I mean, anything that is a net carb would count towards it for sure. Joe writes in, thank you for all that you do. You're welcome, Joe. Can using activated charcoal for a short time cause throwing up and diarrhea? I mean, you would use it to help prevent some of that stuff. I would need a little bit more context on that. Matt writes in, I purchased your vitamin C Synergy. It seems like a nice stack. I want to take it to help adrenals and dopamine and norepinephrine. Any generalized protocol? Yeah, I mean, if you're really good shape, Matt, 1 to 2 grams a day is fine on that, right? If you want to go a little higher, you can go up to 3. That's totally fine. No problem with that. All right, cool, guys. I think I answered everyone's questions for the most part. Any questions here? I think we hit it all up. Awesome, guys. I'll be back on Monday, another live podcast here. So feel free and put your questions below. I love the comments. I want future topic ideas. Thumbs up and a share is well appreciated. And then make sure you hit that bell. And if you're on Facebook and you want to engage more, YouTube's the way to go. Put the app on your phone. Go to justinhealth.com/YouTube. Hit the subscribe button and the bell, and we'll be able to engage more. Awesome, guys. You have a phenomenal day, and we'll talk soon. Take care. Bye.